I received a message asking if I could talk about the pros and cons of delayed reconstruction. This is a big topic. I talk fast, but I can't talk that fast in 3 minutes. So we're going to break it into 2 videos. The first video, we're going to talk about a 7-day to 2-week delay. In the second video, we're going to talk about a true delay, which is months to years after the mastectomy. So why would we delay your reconstruction by 7 days to 2 weeks after the mastectomy? Sometimes we do this on purpose. So let's say you have cancer and we need to get you to surgery to have your mastectomy done, but there's just no availability of your breast surgeon and your plastic surgeon. Sometimes we'll break the surgery into 2 smaller surgeries where on one day you'll have the mastectomy and then 7 days to 2 weeks later, I will come in as your plastic surgeon and put in whatever we talked about, a tissue expander or an implant. The con is it's still 2 different surgical experiences. Usually it does lead to a prolonged drain usage because there's still the mastectomy with its drain and then your tissue expander with the drain. There is a pro though. The pro is that during those 7 days to 2 weeks after the mastectomy, your body is miraculous and starts to make new blood vessels in the overlying mastectomy flap and improving the overall circulation, which means that I might be able to do a reconstruction like direct to implant that I would not have been able to do at the time of the mastectomy if there were concerns about blood flow. So that could be a pro. Now, sometimes we do this not expectedly. Sometimes it is a change in plan. Why would that be? And to discuss that, we need to better understand the blood supply to the breast. The blood supply to your overlying skin and fat comes from a couple different places, from the top, from the sides, from the underneath, and through the breast. So let's say you have a nipple-sparing mastectomy and the incision is underneath the breast. You are cutting off the blood flow that's coming from underneath. Then we remove your breast as part of the mastectomy, removes another blood flow. So that 2 hit for some people is enough to decrease the blood flow to the overlying mastectomy flap where I am concerned about putting in an implant or a tissue expander for concerns of skin necrosis. We don't want that. That is a really hard problem to fix. So in those instances, I will go into after the mastectomy is done, I'll assess things. Sometimes I'll do angiography, which I talk about in another video, and I just make the decision to close. I just close the incision, leave a drain, come back 1 to 2 weeks later, and can safely do the reconstruction. Stay tuned to the next video to discuss a true delay, which is months to years later.